Hey guys, my name is Ricky Brown. I'm a board certified plastic surgeon here in Scottsdale, Arizona. A topic I want to discuss with you today is a topic that is about board certification and what that means and how you can determine whether your surgeon is board certified. So I want to discuss why it's important for you to see a board certified physician, if not a surgeon, from the outset. What's really important about board certification is that means that physician or that surgeon has gone through all of the years of training in order to be educated in the field that they are practicing. And then here's how board certification works, and this is why it's so important here in the United States. So there's one governing institution that is in charge of determining who can board certify doctors in America, and that is called the American Board of Medical Specialties. They are the main governing institution, and what they do is they decide, hey, this group can board certify cardiologists, this group can board certify family practitioners, and this group can board certify plastic surgeons. So in my field of plastic surgery, the only institution that's recognized in the United States of America is the American Board of Plastic Surgery. That institution is recognized by the American Board of Medical Specialties to certify plastic surgeons. So why is that important? The reason that that's important is there's a process that we go through to become board certified. There's a level of education that you need in order to be deemed safe to practice in that field. So what happens for a lot of patients in my field of plastic surgery is they hear this term cosmetic surgeon and they automatically equate that with the board certified plastic surgeon, and it doesn't necessarily work that way. In order for someone to be board certified in the United States of America, you have to basically go through a 6-year or now a 3-year residency in plastic surgery. The first track that you can go through is a combined program where you do a group of 3 years of all the different specialties of surgery, and then the last 3-year plastic surgery, or you could do a general surgery residency like I did or some other surgical residency. And then after you're done with that, you can do an extra 3 years to train in plastic surgery. So for me, what I did was 6 years of general surgery with a year of research in there, and I then moved on to do 2 years of plastic surgery. Now for me, I was grandfathered in. I got into the 2-year program before the 3-year program. So after you have gone through that process and you've done your plastic surgery training, when we graduate, we then have to collect our cases for several years. So every surgery we do for a year gets collected. We have to sit for a written exam and pass that test. And if we pass that test, we can then sit for an oral examination. What happens at the oral examination is you submit your cases, and then we are scrutinized by our peers, and we sit there and we talk about different surgeries, and they basically grill us and quiz us on how we would handle certain cases. Once that is done, and it's a 2-day process, if you are deemed by the board to be a safe surgeon to practice plastic surgery, you can then move forward and practice plastic surgery. Now let's talk about what other people do and how they do, quote, cosmetic surgery that's not a board certified thing. There is an institution out there called the American Board of Cosmetic Surgery. The American Board of Cosmetic Surgery is not recognized by the American Board of Medical Specialties. So you might go see a physician that says they're a cosmetic surgeon, but the problem is if you don't take it one step further and ask them, are you certified by the American Board of Plastic Surgery? Then they may not be a board certified plastic surgeon. Anyone out there can hang a shingle who's an ear, nose, and throat doctor or a family practitioner, and they can go train with this, quote, cosmetic board and then come back and call themselves a cosmetic surgeon. Now, I'm not narking on all of these people who are surgeons as if they're not good surgeons. What I'm trying to say is they have not gone through the process that's required in the United States of America to deem them as a safe, certified surgeon to do plastic and reconstructive surgery procedures. So if I were going to give you one piece of advice when you go to seek out seeing someone, the one question that you should be able to ask when you go to see your surgeon is, are you board certified by the American Board of Plastic Surgery? And if they say yes, then you can almost guarantee that they've gone through the right process to be board certified. Now, in addition to that, you can go to a website and look up whether that surgeon is actually board certified in that specialty or not, and we'll include that link in the bottom of this video. Now, the next thing you have to do once you've determined that your group of physicians that you're going to go see are board certified in that specialty, then it's up to you to determine who's good and bad. I love to use the analogy that everyone who drives has a driver's license, but not everyone is a good driver. It's the same thing with plastic surgery. You might have a list of board certified surgeons that you think are really good, But now it's your job to narrow that list down to the ones that are actually really good surgeons, and then go meet with them and decide if it's a good fit for you or not. So this is just a little bit of education for you about what it means to be a board certified plastic surgeon in the United States of America. And just remember, if they are not certified by the American Board of Plastic Surgery, then they are not considered board certified plastic and reconstructive surgeons in the United States of America. I hope that helps you guys. Have a great day.